cardiac monitoring documentation gaps. This is our Southern California regional policy that LMC has recently adopted. I wanted to highlight a few areas of opportunity in our nursing practice. Monitor techs and nurses are both identified as competent in recording and interpreting of rhythm strips. However, it is the RN's responsibility to sign off on the rhythm. When monitor techs fax over the printed strips, the nurse shall be signing off on the strip and placing it in the paper chart. Currently at LAMC, we do not have the capability or licensing for neon coding data integration into our KP Health Connect system. What this means is that patient data from neon coding does not get stored or saved. Thus, the only running record of tele strips and rhythms is if the rhythm strip is signed off by the primary nurse, placed in the paper chart to be scanned by medical records. Neon coding does not save patient data virtually for 7 days, however, not saved into electronic medical record. Another gap in nursing practice related to cardiac monitoring documentation is documenting the cardiac rhythm interval. You select yes for cardiac rhythm interval monitoring to open up the documentation flow sheet. A complete rhythm strip should include the patient name, the MRN, the date and time, leads recorded, PR, QRS, QT intervals, and rhythm interpretation. All treatments and interventions ordered for changes in patient cardiac rhythm shall be documented in KP Health Connect under critical notification flow sheet. In the next slide, I'll show you how to properly document. You go to Critical Event Notification Lab, you go to Patient Condition, and select Yes. A new documentation flow sheet will open up and you fill out all the areas. Through documentation for significant arrhythmia includes events before and during arrhythmia. For example, defibrillation, insertion of subclavian central line, signs and symptoms that may be related to the arrhythmia, vital signs, and interventions with the patient's response. The next policy I wanted to briefly discuss is Medical Center-wide Policy number 3222, Management of Adult Patients in MRI. Areas for improvement in nursing practice capturing and documenting a set of baseline vitals prior to patient leaving the room for MRI procedure. In addition to getting baseline vitals, it is the RN's responsibility to continuously observe the patient's condition and vital signs for the purpose of identifying changes in physiological parameters and preventing undesired events. This concludes the end of this presentation.